Quick sound quality notes before we get started. We're hosting a guest on today's episode. We recorded our conversation over Skype, and the connection wasn't that great at the start, but the sound quality is much better in the rest of the episode, so please bear with us.
In recent years, altruism has been widely studied, and it seems that our feelings of compassion and empathy may be influenced by biology and genetics. It appears we are hardwired to care for others. Most of us derive a sense of competence, pleasure, and self-worth from being kind, helpful, and generous towards others. So how could something that seems so positive, in fact, be pathological? Pathological altruism can be defined as the willingness of a person to irrationally place another's perceived needs above his or her own in a way that causes self-harm. People with eating disorders invariably criticize themselves and constantly express little self-acceptance and much self-hatred. The major motivation in pathological altruism is to enhance this damaged sense of self-worth via significant self-sacrifice and self-deprivation. The point at which giving becomes unhealthy is very difficult to define. Research that I've conducted has shown not only that this characteristic of pathological altruism is more pronounced in people with eating disorders than in those without, but also that lower levels of eating disorder symptoms are associated with lower levels of pathological altruism and with higher levels of assertiveness and a healthier sense of identity. This means that the tendency to give too much and to take too little may very well decrease with recovery from an eating disorder. Therapy should therefore address so much more than eating, food, and weight. One of the things that people with eating disorders need to learn is that they are entitled to receive from others, have their genuine needs met, confront others if necessary to assert their true values and preferences, and protect themselves in this way from passive acquiescence to things and events they really do not want.
We're very happy to have a guest with us in today's podcast episode. Our guest is Dr. Rachel Bachner-Melman, who is a clinical psychologist, a senior lecturer at Rupin Academic Center and the Hebrew University of Jerusalem, president of the Israel Association for Eating Disorders, and director of Koli, the Jerusalem Center for Recovery from Eating Disorders. Rachel will be discussing her work in the area of pathological altruism, and the story she's just read was based on her book of the same title. If you'd like to know more about Rachel's book, we will provide a link to the publisher's website on the notes section of our Facebook page. I'm Karine Eli.
I'm Liron Cohen.
And we are changing the conversation about eating disorders. You said that the point where giving becomes unhealthy is difficult to define. So how do you draw a boundary between healthy and pathological altruism?
This boundary is always really hard to find. In other words, there's always an area of gray when we're talking about switching over from healthy anything to unhealthy anything. So there's a gray area. But I think that in general, there's two things. First of all, there's kind of a negative emotions that come up when we're giving too much. You kind of find yourself resenting having to give so much and not having enough time or whatever, or having given up and the price is too high. So if I find myself kind of really resenting and constantly angry and negative emotions are simmering, I think that's one sign. And the other sign is really the ignoring myself. If I'm using it as a kind of a defense, because it's really much easier and nicer to kind of keep hearing about other people's issues and problems and giving great advice and help and supporting and getting their approval for sorts of things and so on. That's good. And it's a very healthy behavior, and we all do it and we all need to do it. And thank goodness that we do, because we help each other. But if I'm doing that all the time and I'm not able to focus on myself, I'm not able to ask for anything, I'm not able to focus on myself in therapy and talk about the issues that are really, really there, and I'm using it as a kind of an excuse not to get to stuff that's really concerning me, then I think it needs to be pointed out. If the person's not aware that this is really a way of avoiding issues that really need to be looked at.
And is this how you explain this boundary to your patients?
I think so. Often I find, that they're talking about other people and other issues, and it's hard to get down to their own issues. And in extreme cases, it can be really avoiding coming and avoiding talking about things and asking for real things. There can be in therapy, there is a lot of kind of approval seeking and being a good client and being a good patient and so on. And to get down to really authentic stuff is very important in therapy. And so that is, I would never use the term pathological altruism in therapy. I think it's not a good thing to do, but I think it does resonate when you talk in terms of what they're saying. And I get so angry when I have to be there every day for her, or, this is getting too much and I never have time for myself. Then you can just go back to what people say themselves, and they say it all the time.
Feeling extremely rewarded by helping others has always been a big part of who I am. And in fact, this podcast was born partly from my need to give back from my experience. But I hear what you're saying about that very fine line between when it's rewarding and healthy and when it becomes pathological. However, I do know that since I spent many of my years as a teenager at the same time when I was supposed to be building my identity, both as a teenager and as somebody recovering from eating disorders, constantly focusing on my pathologies, even if my therapist never, as you said, never used the word pathology. It was understood to me that there were things about me that needed, let's say, adjusting rather than fixing. And growing up, that made me associate a lot of parts in myself with pathology. And that line, again, of when is it me and when is it pathology? And I'm just wondering if it might be counterproductive to label certain behaviors and characteristics as pathological. What do you think about that?
I agree with you. Pathological is a word that exists in the kind of psychological dictionary, and it really means, I guess, sort of unhealthy as opposed to healthy. We have this spectrum from healthy to unhealthy behaviors, and everything is both. In other words, if I'm, even if I'm purging and cutting myself, that's probably, what we'd call pathological behavior, but it's also extremely helpful in many ways. And that's why people do it, because it works. And it makes me feel the hurt less, and it brings relief, and also does all sorts of wonderful things that are understandable and justifiable. It's just that I have to relearn other ways that are less harmful to myself, so that nothing is only pathological or healthy. And I think that's a really important point. I think what you're saying is you felt criticized a lot of the time by a therapist even, and by other people saying, what is pathological, what is not okay? I think if you're coming from someone's experience and talking about what is good for them and what is harmful from their point of view, and really just having a look at their things, I think probably you're right that words like pathological come across as being a bit judgmental and critical, and are best definitely not used in therapy, and maybe not at all. But that's sort of where we're stuck with the lingo of psychology and psychiatry.
I'll get to it in my story, but even as I said, even when the word wasn't used, because most of the time, of course, my therapist didn't use the word with me, but the attitude that was conveyed to me was, this is not okay. This is wrong behavior. This is not normal behavior. You're here to fix it.
And I think it's best if it's really when I come myself and I say, this is something I really want to change. If I'm taking 10 minutes to cut my piece of bread and other people are looking at me and I don't fit in and I can't fit into a meal anywhere, that I might come and say, this is not okay. I really want to move on and be one of the others. But if it's other people coming and saying, you're eating too slowly, then it's an external voice and it's a criticism and a judgment.
Which sometimes is inevitable, I guess, because how often do you have a patient who comes to you and says, I don't like the fact that I'm cutting my bread to 10 different pieces? You have to come to the patient and say that, right?
Yeah, well, here it's getting into what's called also motivational interviewing. And then I could ask you, is there any price you pay? Is there, anything that you can think of that might be a disadvantage of eating really slowly?
The way in which the issue is brought up in treatment is very important, as I know from personal experience. I was in the ward for 5 months and 5 days. Every day we had anywhere between 2 to 6 hours of group therapy. That came out to hours of sitting together in a circle, sharing and commenting. In those 5 months and 5 days, I spoke in group a total of 3 times. I guess I didn't feel comfortable taking time from other people who needed to talk. It didn't feel right to take up space, to make everyone listen to my problems and respond to my needs. I would sit there every day for hours between my 2 best friends in the ward and listen. Every time a new patient came into the ward, I would take her under my wing. I was always the person who listened, helped, and took care of others. I was known for my endless supply of tissues, always at the ready to hand out when someone cried, and I oftentimes gave up half of my own mealtime to help my fellow patients deal with their food. I never spoke of my own needs, never shared how I felt, and never asked for help. After about 4 months in the ward, the doctors held a meeting about my status and started talking about how stuck I was, how little progress I was making emotionally. I was accused of taking care of everyone else as a means of distraction and avoidance from taking care of myself. I say accused because it was an accusation. It was thrown at me as an indictment, and I needed to defend myself to earn the right to continue receiving treatment, when apparently I wasn't actively receiving it, but instead just passing it forward. I understood what they were saying, understood why they felt frustrated, but I couldn't explain how I felt. I couldn't explain that taking care of others was the only way I could find a place for myself. I had spent so many years erasing my needs and my personality, I didn't know who I was anymore. I didn't know there was anything left inside. Giving to others, looking out for others, was the only way I felt I could belong anywhere without feeling guilty for existing. It was the only way I felt good about a self to which I felt very little connection.
So, as we've mentioned in previous episodes, clinicians often discourage people with eating disorders from befriending one another because they think these friendships lead to mutual triggering and to ongoing illness. But your story highlights that clinicians problematize how people with eating disorders relate to one another for other reasons too. In this case, not because of the presumed risk of triggering, but because of a perceived excess of care. But it seems to me that these presumably problematic ways of relating to others are not just a feature of eating disorders, but are also due to the often clinical settings and circumstances in which these relationships can develop. So did you feel that certain forms of connecting with other people, for example, through altruistic practices, were more possible because of the way the ward was designed or because of therapy groups and other aspects of treatment?
I believe so, at least for me. The ward was a very therapeutic place. And everything revolved around healing, around finding ways to cope and digging deeper, finding meaning. And it was all, I mean, not all, but almost all of it was done in a group setting. And I think we all, even though we all related to one another through the disorder, we related to one another through a joint journey to recover from the disorder. And again, that was my experience in the ward, and we all felt a responsibility for one another, to help, to support, to encourage. And that was actually, to me, one of the most helpful features of the treatment. And I remember my first week in the ward was extremely tough for me, especially because I had to eat and be supervised, and that's something that I wasn't used to and was very challenging. And the only thing that made me come back to the ward every day and not leave was the fact that all of a sudden I had 25 people around me who understood me, and I felt so embraced and so finally at home that was the most beneficial aspect of the treatment to me.
So paradoxically, it sounds like when you were criticized by the clinicians on the ward for being too helpful or too caring, you were actually being criticized for participating in the ward culture, in a culture that was constructed in a way by design?
That's a very good point. I mean, I'm sure that, again, that, like Rachel said, there's a fine line of how much helpful you can be, and then at some point it becomes, I guess, at your expense. I didn't feel that way, and I actually didn't feel those harsh emotions of being asked too much or of being giving too much. I can relate to that in my private life, but my life outside the ward, I felt that way with family, with pleasing people, with constantly having to say yes. But I didn't feel that way in the ward. In the ward, I wanted to give. I wanted to participate. That was my way of relating to others, even though I couldn't necessarily ask for help. By giving it, I felt that I belonged and I felt that I was useful. And that I had friends for the first time in a long time. I felt that I had real friends who understood me.
So, Leon, you've said a lot about what was helpful and what was unhelpful in terms of feeling criticized and, it being pointed out when you're going a little bit too far, but then it felt okay. I'd like to ask you what would have been helpful both in the ward and maybe before or after. You said with your family it was very hard for you because you kept saying yes and so on. I'd really like to know what would have been helpful retrospectively if you look back. How could people have identified that or helped you in any way to be a bit less people-pleasing and a bit more self-fulfilling?
I think, first of all, in the ward, the 3 times that I did speak in group, I was asked directly. So it made me feel that I wasn't deciding to take up space, but I was actually invited to take up space, that people were interested in knowing what I had to say and wanted to hear me. And so I think that it probably would have been helpful to just be asked more, to recognize that it was hard for me to do it myself and to help me do it. But also, I think that the main thing that would have helped me would have been to probably recognize, and I think that would have been very easy in my case. Any therapist of mine, anybody who hung around me enough time would know that loving to help other people is a huge part of who I am. And instead of maybe using it as an accusation or talking about it as a bad thing that I need to fix or something that is in my detriment, maybe cultivating it and helping me to find the meaning and the purpose in it, helping me find myself, rediscover who I am through that. I think that would have been, because, there's this line that I heard once that I really love, which is, whatever people blame you for, cultivate it, it's yourself. And I've learned along the way, at least from me, that everything that is negative about me could also be positive. It's just a fact about myself that if I treat it a certain way, negative aspects of it come up, and if I treated it a different way, positive aspects of it come out. And so I think if the emphasis were on the positives rather than the negatives, then they would have been able to help me own who I am and use it as a wonderful thing to find meaning in life, as opposed to a bad thing that hurts me. But I have a follow-up question for you, Rachel, now. So when I was accused of distracting myself from treatment by helping others, I was actually taking the treatment that I was receiving. I just was doing it in the way that I could in that moment. So I'm wondering, it made me feel a little bit as if I'm being punished for who I was or for the only way that I found to be able to receive treatment. And I wonder if we can really be blamed for such a behavior, or should it just be considered another symptom of the eating disorder? And do we actually think it's a symptom of the eating disorder?
I think that having trouble receiving treatment and having trouble agreeing to therapy at all is often an inbuilt part of an eating disorder. It's like a symptom. So people can't be blamed for that. There's so much fear about change, and there's so much safety in what exists, and nobody knows that they're going to get better and what's going to happen if they start to eat regularly and leave all their symptoms. It's very, very scary. So I think that side of the hesitance or any ambivalence to deal with treatment needs to be understood and accepted and respected. And, we can all help people to get their motivation kicked in a better way and to help them straighten out what really they're looking for and what they'd like to change and what would be a healthier way of life for them. But we need to stay away from any form of criticism or blame.
Do you think that it is that we can say that pathological altruism or the tendency to be altruistic is part of an eating disorder? And if so, is there a genetic or neurological aspect to this? Or what do you think? Or is it just the connection is psychological, the urge to deny one's need, not take up space? I mean, these are basic elements of eating disorders. What do you think?
So I think that research-wise, we don't really know enough yet about how specific these characteristics are to eating disorders as opposed to other problems such as depression, anxiety. I think that anyone with a low sense of self-worth and value will try to tend to do these kind of self-enhancing behaviors and seek approval and fear confrontation. Again, I think we need to look at recovery also in terms of becoming more self-assertive and confident and developing a sense of identity, how specific that is also to eating disorders. And when we talk about recovery in general, if we can talk about recovery from eating disorders as a specific concept, and is it any different or very different to recovery from depression or anxiety or a personality disorder or anything else? This is a characteristic that probably goes across different diagnoses, transdiagnostic kind of behavior or whatever. And it could be, we don't know how specific it is.
You said a lot about fear of confrontation, fear of conflict, people seeking to maybe boost a low self-esteem through altruistic behaviors. But I've also heard from people with eating disorders who framed their altruism, whether towards others or towards the environment or animals, as part of their existential philosophy, part of who they were, part of the types of caring relationships that they wanted to foster. So I was wondering if you've encountered that as well, and what you think about the idea that what might be perceived as so-called pathological altruism might actually be just a way of being and of thinking about one's place in the world?
That's a really, really interesting question. And I do agree that there's something in, if you want to call it the personality or the way of being of people who do develop eating disorders, that is very, very sensitive to what goes on around them, to fellow human beings and fellow creatures. So that I have no empirical basis to go on here, but just from observing and experience, I think that there's something that I would define as extreme sensitivity to one's environment that is very, very well developed, and that is an advantage, but also a disadvantage. And that's a reason that people are so susceptible to suggestions of fulfilling expectations, which might include the suggestion that we should look good, that we should have a body that looks like this or like that, or is thinner or is more, looks more shapely or whatever. And it also is expectations to help others. So I think you're right that there is something very intrinsic in the caring nature of people who develop eating disorders, and that this does need to be developed because it's a huge advantage as well.
Very, very, very fun conversation. I really enjoyed it, Rachel. Please come back and visit us again.
Oh, of course. I'd love to come back.
In our next episode, we're going to talk about food beyond calories, beyond ingredients. We're going to explore food in the context of the family and in the wider context of culture and society, and think about how eating disorders connect with wider logics of food and eating.
Thank you for joining us and changing the conversation. Feel free to email us at any time with comments, questions, or anything else to changetheconvoed@gmail.com.
And don't forget to subscribe to our podcast and follow us on social media, where we also have links to other resources and further reading. Look for Changing the Conversation About Eating Disorders on Facebook and at ChangeConvoED on Twitter.
We hope you join us again for our next episode on the first Tuesday of next month.